Welcome, my friends, to the Bob and Brad podcast. My name is Mike Keenitz, and today I'm interviewing Dr. Ray McClanahan, who is a podiatrist and works at the Northwest Foot and Ankle Center located in Portland, Oregon. He is also the creator of the Correct Toes toe spacers, which we will talk about later on in the podcast. Today, we're talking about foot health, how to fix bunions without surgery, heel pain, hammer toes, shin splints, and plantar fasciitis or plantar fasciosis, depending upon what you want to call it. If you are watching this on our main YouTube channel and would like to hear the whole episode, you can find it on the Bob and Brad Podcast's YouTube channel or anywhere else podcasts are streamed. So without further ado, here is Dr. Ray McClanahan. So can someone fix a bunion without having surgery?
It depends. Most people can, but there's a subset of people that allow their big toe to go away from where it's supposed to be. So let's see, away from where it's supposed to be, like this, towards the second toe. And if the big toe pushes the metatarsal, let's see, I'm doing it backwards, so I think I'll just discuss it instead of trying to do a graphic. If the big toe pushes against the inside part of the metatarsal bone for too long, it will literally create a space between the first metatarsal bone and the second metatarsal bone, which generally does not reduce itself. We can get those people's big toe straighter, and if we improve the footwear, we can probably get them out of pain. But there are a small portion of folks that this is not going to reduce the bump completely. Now, these folks are typically 6th, 7th decade. They're typically females who most of their life they were in that tapered toe box position. And for the ladies, you don't even have to wear a stiletto high heel shoe to get a bunion. All you need to do is wear the shoes that are sold to you based on the metal measuring device, the Brannock device, and you'll still get a bunion. So the answer to your question, Mike, really depends upon, is there flexibility in the bunion? In other words, can the client take their big toe and pull it away from their second toe and make it straight? If they can do that, they'll have success with this. In other words, if they have the mobility, can wear some kind of a toe spacer, and are willing to wear the shoes like you and I wear, then they will slowly see their bunion reducing. And for anybody in the audience that may consider doing this, I encourage you to take a picture of your feet from top to bottom before you start this, because it's slow. And sometimes it's ungratifyingly slow. But most of the people we work with, it does work. For instance, for me, it took me 3.5 years, but I would consider myself to have been a severe case. For young people, we've got testimonials on our website, people reversing them in 9 months, and these are pictures, and they're not photoshopped. We're not trying to sell product. We're really trying to provide optimism and hope that this can happen. Because most people that I talk to day to day, including yesterday, are told that this can't be non-surgically corrected. And that's not true. So for the audience, anybody that's got a bunion, got a family member with a bunion, dive into this information, give it a try, because it will work for you. But more importantly, Mike, even if somebody in the audience has a bunionectomy, these principles are still applicable. When I have somebody with a bunion, I tell them we're going to go this natural path. But even if you need an operation, we're not wasting our time, because if you need the operation, you'll still do this stuff after if you want to have success. I learned that the hard way. I had a young lady. She was 36. She was a runner. She had a bunion. I operated on her, made her big toe straight. She was happy, sent her on her way. About 7 years later, she came back and sat in my office and looked at me kind of unusually and said, "I thought you did a good job on my surgery. Why is my bunion back?" And I had just read Dr. Rossi, and so I pulled the sock liner, which is the removable piece, out of her size 7 yellow Nike running shoe, and I put it under her foot like Dr. Rossi taught me to do, and I superimposed her foot on it, and she and I both had a collective light bulb moment where I realized that my scalpel and my screw and my saws didn't fix the problem. The surgery temporarily made her toe go straight, but her shoes pushed it right back. And this happens. It's happening right now. It's not at all uncommon to have multiple bunionectomies. And it's not uncommon for the podiatric and the orthopedic community to consider that to be normal and acceptable. And in my opinion, it's not. If people get the information, you shouldn't have to keep having an operation. But to your earlier point, root cause is not being addressed. In podiatry, we're told that bunions are in your family. It's genetic, it's hereditary, nothing you can do about it. You might get an orthotic or you might get an arch support, which might slow it down. And that's also not true. I ask my podiatric colleagues constantly, how is putting something up under the arch mitigating the tapering toe box, pushing the big toe up against the second toe or under the second toe? And it can't. There's no answer to that. So bunions are not, actually it's reverse. When your big toe starts going towards your second toe, then your arch gets flat. So podiatry teaches it backwards. We teach our students, jack up that arch and make the subtalar joint neutral, and then somehow the bunion's not going to get worse. It's not true. It doesn't work. It never has worked. So footwear is critical. People with bunions want to start standing on the removable piece that comes out of all their shoes. And when they do that, they'll see a one-to-one relationship of the sock liner, or also called the insole, is the same shape as the upper part of the shoe. So if your foot is not completely on top of that insole, the upper part of your shoe is squeezing the toes. And early on, this is painless. So we deform our feet into bunions, and we start this at age 3 or 4, but it doesn't hurt. And it happens so slowly that a lot of people aren't really even aware of it. In fact, a lot of folks come in and they're like, I looked down at my feet yesterday and I noticed I have a bunion. My big toe's crooked. And they hadn't really drawn their attention to it, but once they do, they recognize it. But it's a slow, insidious process that can be prevented. So basically, what we want to do is get the information to people that the footwear is primary piece. It's not about your arch. It's not about your family. Nearly 100% of people that have a bunion, and everybody in their family that had a bunion, have feet that are wider than their shoes for their whole lives. And furthermore, their shoes are shaped wrong. They're widest at the ball and get narrower. And for the audience, we did a 3-part blog series called The Hereditary Bunion Myth. And we also did a video where we show an x-ray of a person inside of a pointed toe box shoe, showing that the bones are held in a bunion. And the thing about our body that I'm sure Bob and Brad would agree with is, if you hold your body in a habitual position, it learns that. So for instance, you and I are both sitting in chairs right now, so our hip flexors are starting to get a little short and contracted. And if I sit on my phone all day and do this, short and tight, long and weak. So our feet are the same, Mike. If we lift our heel, our calves get short. If we lift our toes, our front calves get short. Taper toe boxes, bunions, and Taylor's bunions, and so forth, and weak arches. So really, bunions are mostly related to footwear. Once you get footwear that fits you, you're likely to be able to reverse your bunion.
What else? Are there any other tips to helping reverse bunions besides footwear?
Yeah, we have a really great rehab that we do called the bunion stretch. So basically, and it's on our website, you are essentially working on the muscle in between your first and second long bones, which is called the adductor hallucis. When we wear pointed shoes, that muscle draws the big toe towards the second toe, and in my case, under my second toe. And so this rehab strategy allows the individual audience member, perhaps, or anybody not needing to go see a massage therapist or physical therapist, can actually work on that little trigger point that occurs in there. And once that muscle starts to loosen up, then the big toe is going to move away from the second toe. But I'm careful to tell people with bunions that even if they never touched their feet, never did any of this rehab, but just got properly fitting shoes and used a toe spacer, it's going to slowly change on its own. But I always like to share the rehab because mostly I do athletic work, and my athletes really want to get better quicker. So we try to accelerate their recovery with doing some of these things.
Yeah, and we talked about your correct toes before the podcast started, so I don't think we actually showed them yet on camera, but these are the toe spacers you guys created, correct?
Correct.
So do you want to tell us a little bit how these work?
Yeah. So when I read Dr. Rossi and I started putting single spacers between my toes did change, and I felt better, and some of the back pain and knee issues and foot issues started resolving. But when my feet started to sweat, they wouldn't stay in place. And this is before I had an awareness of toe socks. And so they're sliding all around, and I'd have to stop my run and kind of put them back in place. And runners don't want to stop their run, for something like that. And so I was out mountain biking with a buddy of mine who is a designer, and I was complaining a little bit. I knew he worked in silicone, and we were working on a couple projects. And I'm like, can we make something that is one piece that does the same thing so that I'm not stopping my run every 3 miles to jam these things back in place? And he's like, sure, we can. And we did. And we made a lot of mistakes with our early prototypes with materials and design and so forth. But as we tweaked it over time, we got it down to where we felt it was anatomically correct. And most importantly, we want people to have this in their shoes. And so that was also 20 years ago. And now we have 4 sizes because obviously there's all kinds of different size feet. I would say to the audience members, the overwhelming majority of men and women wear medium, which might sound unusual, but again, it's really, we try to provide broad parameters like your shoe size, but for the audience, it depends more upon how big around are your toes. In other words, what's the circumference of your toes? Because that is the critical piece in terms of how your toes fit into the cavities of the product.
Sure. I actually have Brad still in the package here. Yeah, medium is men's size 7 to 11. So that's what I have. I didn't know what mine were. I didn't have my package anymore. But these are also, so yours are different than a lot of other toe spacers because most of them you can't really walk or even run in, and yours are actually functional.
Yeah, that's our whole goal. The others are more passive, which sometimes can have some benefit. However, what we've discovered is where people really get their most benefit is while they're active and when they're weight bearing. In other words, when they spread their toes and when they're weight bearing, the brain-foot connection is heightened, and we get really good information from our feet that help our brain to tell our bodies what we need to do. So that's how we recommend it. We do occasionally have people that wear them at night. And we didn't early on recommend that. We've since changed that, mostly because of patient and customer feedback. I had a lady yesterday that told me she only wears them at night, but she feels more comfortable when she gets out of bed. So that's one use for it. But yeah, we're trying to differentiate ourselves from the passive toe spreaders to a more dynamic toe spreader.
Yeah, I mean, it is easy to wear them in bed because you're not paying attention. They're just there stretching all night. So it's a nice passive way. And yours are different because you can expand the 5th toe or the 1st toe as well. So if you need more spacing, that can help as well.
Correct. Yeah. So just like we want to take a really slow, gradual approach to accommodating natural footwear, which is also sometimes called minimal footwear. The industry also likes to currently call it barefoot footwear. We start with the conventional or the separator the way it is, and then depending upon the level of deformity of either the big toe or the 5th toe, we can at some point down the road, and usually it's probably 3 to 6 months, we can start to put another little piece of material in there. And what we like to use is the sock liner that comes out of the shoe. We usually have people leave that out anyway because it's just foam, and most athletic shoes are soft enough under that. So we have people cut a little chunk out of their sock liner and take a bathroom tweezer and just pull it down through there, or you can just push it into the little cavity. So that slowly over time, if you've got a regular bunion on the big toe, or you've got what's called a bunionette where your 5th toe is coming in under, you might eventually want to put more material into that outer cavity to push your 5th toe out a little bit more.
Sure. Yeah, because that's what I need them for. I actually don't have a bunion, luckily. My dad has one, but yeah, that's what I find the benefit is getting the 5th toe out there. And like Brad has, kind of bunions and cross toes. And Bob has a hammer toe. So we have all sorts of foot issues on our side. Good thing we found you, huh?
Yeah.
All right. Is there anything else to add about bunions before I switch topics?
Not that I can think of.
Okay.
Oh, actually, I take it back. One more thing, Mike.
Sure.
It's interesting. Sometimes people will have bunions only on one foot, and that is a curiosity to them. They ask, well, if I've got the same influences with shoes, why am I only getting one bunion on one foot? And usually that's related to the bunion foot's a longer foot, typically, which means there's more of the toes in the tapered part in the toe spring. I also find that there are body asymmetries. And so if I see a bunion on one foot, I might also send that client out to my physical therapy or body worker friends to have a whole body evaluation. ranges of motion, muscle testing, testing for weakness, testing for contracture, to see if there might be something else further up the chain. And I also have found that when people have a leg that's longer than the other, that foot that's longer will sometimes pronate more, which also can sometimes have a relationship to the big toe joint function. So footwear is the first thing to look at, but I also strongly encourage a whole body evaluation.